Thank you, sir. Again, very good evening. Very nice. After the very interesting talk by Dr. Inge, now I'll speaking again very interesting topic and very close to my heart: non-invasive glucose monitoring. I think all of us want that, definitely for sure, and that's the need of the hour. So, with that note, I'll go ahead. This is my disclosure, but for this presentation, I don't have any conflict of interest because I'm not representing Medtronic here. I'm representing as a physician. But it's important to show the disclosure. Yeah. Now, if you see the diabetes management, we know glucose monitoring is the key for any diabetes management. And if you see from the initial days from 1500 where how it was measured the glucose, and now with over years, first generation, second generation, then we had glucometers, and now at the end, now we have we have the continuous glucose monitoring systems. What we call them, they are minimally invasive because you still have a soft cannula or a sensor which goes just below the skin. So they are, and which gives you a continuous reading. So they can be intermittent, they can be continuous, but they are minimally invasive. And if you see the glucose sensors, if you see the evolution of glucose sensors from those days, 1956 and now, so there have been a lot of scientific studies because nobody likes to prick themselves, especially if you see a type 1 person, how many times they have to prick. It is really very painful. So over the years, there have been multiple research, multiple products came into the limelight, and finally they have tried. If you see in the last like 10 years, 2012 to 21, they have tried contact lens, microneedle sensors, even tooth enamel sensors, epidermal tattoos, so many things. But again, we are still little far away from actually seeing what is available in the market. And coming to non-invasive, when I say non-invasive, basically I am talking about that there is no invasiveness. We are not pricking. It could be basically, if you ask me, either we'll be using an optical method or an electromagnetic method or a physiological method to check the blood glucose, or may not be blood glucose, maybe tissue glucose or interstitial fluid glucose, or some researchers they are trying from saliva, they are trying from tears, they are trying from sweat again. So these are the various mechanisms which are available, and if you go to the literature non-invasive, you will see thousands and thousands of papers on this. If you are an engineer, you will be able to understand more about these technologies. I will come to some of them. And if you see the patents as of now, multiple research is plenty. For last 20-25 years, you will find multiple patents and so many things from across the world on non-invasive glucose sensors. So research is been going, lot of funding, but as I said, we are still have not got the one in our hand as of now. Now, as I said, they tried in blood because blood has the maximum in a normal healthy state, the glucose level. Then it's the tissue, ISF, and then the urine, which all of us, the researchers have tried. And then if you see the tear, saliva, and sweat, they have very minimal amount of glucose in that. So all been tried a lot. And if you see the picture here, the person, so depending on the area, they have tried different technologies. And interesting is on the other side, if you see there, basically these are the optical technologies where they have used IR, infrared, near infrared, mid infrared, far infrared to see how it penetrates the skin. And by the level of penetration, they are trying different permutation and combination to actually measure the tissue glucose and some of them blood glucose. Now, if you go to the literature, this is for your continuous monitoring of glucose. Now, if you see technologies, you will see most of them are either NIR spectroscopy or they are Raman spectroscopy. These are the two most common technologies which have been explored for last 20-25 years across the globe. And if you see intermittent, basically it is more of, again, NIR, PPG, and also Raman. Again, these three are the most common technologies which the researchers have actually narrowed down. So if you see most of the products which are there in the market as of now, there are no products by US FDA approved. I'll come to that. Some of them are there which have a CE mark, but again, there's shortfall of exactly how as a clinician or as a person of diabetes you want. So this, as I said, these are the three most common technologies currently explored a lot. If you see PPG, that is photoplethysmography, and near infrared, they all use light at different frequencies and try to penetrate the skin and check the blood glucose. And on the other side, Raman spectroscopy, it uses a laser diode. So now these are the three most common technologies being explored by all the researchers, by all the engineers and all the researchers. But most of the products have failed when they are using only one, PPG or NIR or Raman spectroscopy. So now what they're doing is they're trying to use multi-sensors. In one of them have both PPG and NIR. One of them have Raman and something else. So that's the line where the research is going on. And a lot of them have already been withdrawn, like Alcon, Novartis, they tried, BD, C8, even Apple, they were telling that I will come with a watch. They have also discontinued. A lot of them have failed from the reality. And if you go to the literature, you will find many products there in the market, especially in the European market. I think Dr. Inge will be, I think some of them are there in their market there, but they are CE marked. Again, none of them are US FDA marked. And this is the latest one, which I just got from Facebook, India, Facebook. This company is saying, please book yourself, we are coming soon. They have not told what technology, but they're saying not for patients, it's for wellness. You just use fingers and you'll get a report. You can see that picture. And just pay 500, book it. Again, they say a disclaimer, it is not for patients, it is just for wellness. And what technology they're using, they have not mentioned it. But again, so they can measure, it can measure blood glucose, A1C, oxygen just by that. I hope they are using either a PPG or a NIR or a mixture of it, but again, they didn't reveal it. Now, as I said, of the 47 products currently, if you see you will find out in the literature, none of them are FDA approved. There were 2 products which are FDA approved. They already have been withdrawn from the market because they were not accurate and reliable. 2 were approved and they were in the market, but they have withdrawn. Out of the other 44, you have 4 products have CE marked, which are from what is Glucotrack, G-Wave, then Glutrack, and EGM 1000. Again, these are available in some of the European markets. They all are non-invasive. Again, they have their own issues, accuracy issues and cost issues. If somebody is accurate, then they are not affordable. So again, balance of these are just being. Coming to the most promising ones, as of now, from what I could find out, these are the most 3 promising non-invasive, which will be, I expect we'll see soon in the market. This one is Glucoware by Afon. It's a Welsh firm, and they basically are using a radio frequency, which will be like a wrist, and it's a real time. I met the innovator last time in one of the congress in India, and they are quite ahead and doing clinical trials. I met them at Kochi, I think last DTech meeting. So some of you must have met it. Second is Moglu. Moglu is from, again, a lot of research from the Professor Peter Sour's team, and they are tying up with Jocelyn Diabetes Center to do clinical trials. So again, they are quite, that results are quite promising, and maybe that will be the first product in 2025 or 26 to be getting approved by US FDA. And the third is Isaac, which is from from breath. So they are going to measure your VOC, volatile organic compound, specifically is acetone and others, and they will tell you about your glucose levels. Now, these 3 are the most promising ones as of now, which I can see they have gone really ahead in clinical trials. Again, the major issues still remain: accuracy, difficulty in reliability, variability, and high signal to noise ratio. That is, if you ask the software engineers, they will tell you this is the main challenges. And as a physician, we should look at these things: performance, how other things are being done. So unless until they do all these things, they are not going ahead to the market. And this is how the path is to develop phase 1 and phase 2. And as Dr. Amit said, it has to match WHO reassured criteria, real-time connectivity, ease of specimen collection, but the test should be affordable, sensitive, specific, user-friendly, rapid, robust, equipment-free or simple, environmental friendly, and deliverable to end users. Unless until you have a product like this, it will be very challenging for come to the market. So to summarize, non-invasive glucose monitoring has witnessed significant advancements by integrating optical and microwave technologies, hybrid sensor systems, and in recent times, I hope with artificial intelligence and machine learning, you can actually work out on the limitations of these technologies and get a good algorithm which can overcome these challenges. Although there are still several technical, environmental, and regulatory challenges, but there is a strong demand, there's a strong motivation, and there's a big market, and a lot of funding is available. I sit on Government of India startup program for medtech. We really promote engineers and doctors to come and apply projects and get funding. To be very frank, I have evaluated 20 or 30 of them till now. They come to till the lab level, but then in the clinical level, they all fail. So, but still, I'm hopeful that we'll see a non-invasive, continuous or intermittent glucose, which can be used for medical reasons. Thank you very much for a patient hearing.
Thank you.